It is considered as a lymphoid organ. It performs the following functions: removal of worn out RBCs by phagocytosis, hematopoiesis during fetal life, and lymphopoiesis throughout the life. Immune response by production of lymphocytes under antigen stimulation and production of plasma cells which produce antibodies. Phagocytosis of organism, reservoir of RBC. Now, this is important because see, you having a splenomegaly. Previously, malaria was very common. You used to get huge spleens, ekdam up to the left iliac fossa. In those cases, you have to do splenectomy or something. But even today, even these days, there's a small increment or enlargement of the spleen. Then I use the antimalarial drugs. And if it is not any inconvenience, it's not so huge, then don't go for surgery. Now, some interesting facts. Under some circumstances, the hemopoiesis function of spleen may be restart in adult life. Hemopoiesis function of spleen may be restart, and these conditions include chronic myeloid leukemia and myelosclerosis. Now, for chronic myeloid leukemia, you have to go for the investigations and your splenic biopsy, and you can see if there is a myeloid leukemia, chronic myeloid leukemia. You send to an oncologist, medical oncologist, and he will suggest you what will be the treatment and the mode of your management and treatment. So don't see many things you will get at in study in this book, but day to day I am encountering for the last, I would say rather 1980, I was in third year. I assisted my father, and from fourth year, he was on the right side, the main surgeon. I was on the left side assisting him. All of a sudden, there was a case of gallbladder cholecystectomy. My father said, let's see what you have done, what you have learned. Then I came on the right side. Though it is illegal, but I had the opportunity, Guru Shishya Parampara, and I challenged my father, not verbally. I challenged him that I must excel you. With his blessings and his, all the teachers from the nursery, KG, kindergarten Mrs. Faulkner, with the beautiful floral skirts and lipstick, red lipstick. Actually, from that day, I didn't allow my father to come on the right side. Challenging Sushil Banerjee means very tough, very tough. But it was a memorable time I spent. I had multiple opportunities going abroad, but I didn't make it. And I think God did not allow me. So, what I told you, the good MBBS is a good postgraduate. This slogan is for you people this year's. Like, anatomy is your gateway to medicine. Like that, I'm telling you that my journey is a complicated journey. কিচ্ছু ভয় পাবে না। So you are all reading because I am seeing your faces, that you are understanding. If I pull you up, you are saying something. Your friend is saying something. Now he might be very versed in speaking. He might be a bit dynamic. But all of you have the potentialities. ভয় পাবে না একদম ফেল করবে আবার হবে এক্সাম you know Uttam Suchitra of Bengali film you see Shaptapadi film it's medical related I think now in Calcutta Medical College one of the students he fails every year. What I want to say is that failure is not you don't be very worried about it. Fail করবো এটা বলবে না কেন what I am going to say is that ধরো স্প্লিনটাই তুমি অপারেশন করতে যাচ্ছ তো স্প্লিন একটা হিউজ স্প্লিন করছো ব্লাড ট্রান্সফিউশনের সব ব্যবস্থা আছে ইউ আর হ্যাভিং অল ব্লাড ট্রান্সফিউশন থিং. Now you have to identify now the splenic artery, the tail of the pancreas, which rests in near the hilum. Suddenly see one of the arteries, it spurts and bleeds. You have to bring it and tie it within ligatures, clamp. Think. Even suction machine, my father didn't have. I went for postgraduate, he furnished the OT. It was just wooden table. On that he performed surgeries. I have not changed much, but I have got 2 hydraulic tables. But these modern days, with remote you control up and down, no. Just I'm telling you the situation that was. Now you have to totally, you are very intelligent. This generation is very intelligent. Only you have to put in your effort and don't be overconfident. That is one thing, this thing that to tell you, I actually felt very bad. I gave him the marks. So he doesn't come again. So again I have to push and give him marks. No. Practicals, no one is failing. But that doesn't mean that you are getting the marks and my practicals will mil gaya. I gave 8, 7, 8, 7, 9, छोड़ देते. वो जो बोलता है 9 दे देते. 1 mark I keep it in the department. I don't carry it in my purse. Now one thing I tell you, that see, now you have to remember, myeloid leukemia, myosclerosis. You have modern biochemistry, there is some techniques, your investigative techniques that you can apply. But until you know what is the cause of the enlargement of the spleen, you have to know, and you have to then produce it in your prescription. Now, pitting of RBCs, the splenic macrophages can remove the inclusion bodies from abnormal RBCs without destruction of RBCs. See how nature is. How nature is. The splenic macrophages can remove inclusion bodies from abnormal RBCs without destruction of the RBC. The macrophage that picks up your inclusion bodies of a cell, there are all inclusion bodies and mitochondria and everything, but he is very targeted. Like John F. Kennedy, he was shot from a tower in those days. You can imagine the shooter, he got it, tack. So it is like that. The splenic macrophages can remove inclusion bodies from abnormal RBCs without destruction of the RBCs. For example, removal of Heinz bodies from due to altered hemoglobin. This Heinz bodies. Now, spleen stores RBCs that get released into the circulation when needed. And it's a storehouse for RBCs. It's a storehouse for RBCs. Now, spleen location. See, this is the mid-axillary line. Mid-axillary line on the left. Mid-axillary line. Okay. Now you can see the 9th, 10th, 11th rib. The spleen. This is the superior, inferior, left, right. This is the posterior view. This is the posterior view. This is the mid-axillary line. And you can see this type of sketches. You just go on, you have nothing to do, just go and practice. Now, spleen is situated in the left hypochondrium and partly in the gastrium, epigastrium. It lies as a wedge in between the fundus of the stomach and the diaphragm. That's why what I told you, when the body next coming week is there, you just put your one finger in between the stomach and the spleen is like this. I went, but it was in the formalin chamber. That's why my eyes are watering. And now it lies as a wedge in between the fundus of the stomach and the diaphragm. Axis of the spleen, the long axis of the spleen is directed downwards, forwards and laterally. It coincides with the left 11th rib, and the long axis of spleen makes the angle of 45 degrees with the horizontal plane. The spleen lies opposite the 10th, 11th and 12th ribs. 10th, 11th, 12th ribs. Behind the mid-axillary line under diaphragm. For stomach bed, spleen, you just see it at least for once or twice. When you are reading it, you have it on your phone. I don't know how you are download or something like that. I'm not acquainted with your tab. You just see it. You will never forget. I mean, it tipsao bole dichi kintu. You will get it there. Okay. Now, anterior superior border may have 1 to 2 notches near the inferior pole. I have now location I told you. I have seen in my clinics, in my college, in my chamber, huge spleens, even small, just enlarged. The notch can be in a thin abdomen, it can be felt. But when you take a shashnao, charo, when you think of any liver this enlargement, you think of any splenic enlargement, you see your newborn, the mother will say, because the liver is always in a newborn baby is enlarged. It's normal. Naturally, she'll come, she's aggrieved. She will come and tell you, Dada Babu, Didi Muni, এসব বলবে তোমাকে তো you tell, you just see, okay, you see, let's see, catch the baby, and you palpate. To see it for your own reference. Second thing, you see anemia, you see there can be neonatal jaundice, but you have to console the mother. This is the psychic effect of practice. He complains of anything. যে ডাক্তারবাবু আমার এখানে পেটে ব্যথা হয়, বুক জ্বালা করে, তখন তুমি তোমার কোয়েশ্চেন জিজ্ঞেস করবে যে এই ব্যথাটা কি ডান দিকে চলে যায়, arm, left arm. Then you will say that you think of cardiac. Okay. If anything goes into the inferior, this point, scapula, then it is related to the gallbladder. So, when you are seeing spleen, you just have to have in mind your you can see the edges, you can feel it. Taking food, 11 years I was Angrez, but when I have food nowadays, I use spoons, multiple spoons. अगर 5 सब्जी हुआ तो 5 कटोरी में 5 स्पून चाहिए, दही के लिए अलग चाहिए, but I use my hand. Now why I am telling you that you have to practice, you have to feel, you have to see. Next day you come, there's one spleen, you please see it. In examination hall, even there is a large kidney, large kidneys are there. You're in deep tense. Naturally, we had this same feeling. Then you go and see, you're seeing, তুমি একবার স্প্লিনের দিকে হাত দিচ্ছ, একবার কিডনির দিকে হাত দিচ্ছ. They are not similar, but these structures are like this is the spleen we have, and the kidneys are 2-3 kidneys are there. But what they identify, it is a hilum, it has a hilum. So the your what structures are going inside the hilum? It is a common question that every student will be asked. Even the honors wala, gold medalist wala ko पूछेंगे, आपको भी पूछेंगे. When examiners don't have other question to ask. तो किडनी ले लिया, भाव, कितना भाव है? Vein, artery, ureter. You hold it, and ureter dangles down. So accordingly, you see the two. If there is 2 kidneys, you see, you lift up right kidney or left kidney. You don't know it's in the tray. You see it, but you have to. If you say these things, liver tatolo, then you pick up that liver. Now liver is also, it's easy. And taking the liver, you just don't do this, don't do this, don't do this, ulta palta, like a spinner. He takes the ball. He just does, he puts his, in World Cup we have seen, you don't do that. Tumi dekhbe, posteriorly veins, large vessels are there. Anteriorly, there's one ligament. Ligament, that you see in, I don't have 2 pockets. I have to make 2 pockets. Now, your, I was telling about the liver, okay. Now the falciform ligament is, when you see the dead body is prone, this is in the anterior wall it is. Okay, when you ever get an opportunity in 3rd year, 4th year to peep in into the surgical operation, most are done in now, your gallbladder are done performing by laparoscope. But when you open surgeries are there, or your dead bodies, not your dead bodies. Okay, now this ligament is attached in this thing. Okay, now this is thing, then the surface like this. Superior surface, inferior, bare area of liver, these are that. We pick up. Ekdam suniye, don't think complicatedly. Things are there, तो आप वो बोलेंगे तो आपका 5 नंबर हो जाएगा. जो भी है, bone, you see, and don't go on this thing. See, you have to always imagery, imagery, 3D imagery. When you are reading, you think, you just see the anterior, the brain, you take the brain, you hold it like this. Now the anterior, posterior, you just correlate with your books, then go for notes. Online platform, I don't know, but whatever you get an opportunity, please attend the classes. Don't, because these blunders are going on for online platform. You don't get the geo, तो आपका routine का disturb हो जाता है. Internet is not connected, Wi-Fi is not connected properly. But if you find comfortable, then you do it. They are teaching excellent. Why so many doctor students will be reading, going on for online? I might be an old person, that's why I'm saying I prefer more एकदम ground level में काम करना है. Okay, now see external features. Two ends, inferior pole, anterior end, superior pole, posterior end. Two borders, anterior superior, posterior inferior. Two surfaces, superolateral, inferolateral. When I show you next week in the whatever is there, I will take it and show you. Okay. Now see, two surfaces, superolateral, inferolateral, hilum. This is the hilum. See, you just, वो जो ball नहीं है घोड़ा ना spinner bowler there, don't do this. You just hold it. You see, you please integrate the way I'm telling you. Integrate. You know, colors. You know colors. I had the opportunity. I am a colors. From 1975 till date, I am a learner. And this colors, the water, you have seen PC Sarkar's Junior's Magic, the water of India, it is like that. Even a Daima, you know Daima? The woman who delivers the child in the villages, and still there are people. So the first efficiency stitch, and when I was a student, was taught by Sarala Didi. She taught me how to cut and stitch an efficiency. And I am taking nursing class. I have shown her photograph. So everything, Subrahma is a wonderful teacher. Abhijit sir is a wonderful teacher. I was not in full-time teaching. After my graduation, after 86, I joined teaching profession in 2005. 16 years I was in practice. So one thing, you see and every organ will have a blood supply, will have a venous drainage, have a lymphatic drainage, and your organs are supplied by nerves, sympathetic, parasympathetic. Momentum is an organ. Why I'm telling you, this is the basic actually. So when you are seeing this, you have to see the orientation. It is like this. Okay. Now see this surface. This is the hilum. You can see, don't pull, don't pull, don't pull. You see the hilum, the vessels going inside and outside. the borders, surfaces, relations, thoracic cage, এরকম. What I'm trying to impress is saying that you take the things. Like I'm seeing many students here, আর ওই লেকচার নোটটা শুনে নিলে একবার স্পেসিমেনটা থাকা আছে, একবার দেখো. একটা মেয়ে তোর ভাল লাগলো, কিন্তু তুমি তাকে বিয়ে করবে না, তা তাকে তো একবার দেখো. না, ইট হ্যাপেন্স, আই এম টেলিং ইউ, ইট হ্যাপেন্স. কিন্তু এখানে কিন্তু দেখতে হবে. নাও প্লিজ ওয়ান স্প্লিন, ইউ প্লিজ সি ইট, অ্যাটলিস্ট দেখে নাও একবার, 5 মিনিট করে দেখে নাও.